Welcome, and thank you for watching this first episode of our Top Trends in Healthcare video series. These videos are a series of discussions with industry experts that aim to shed light on current trends shaping the future of healthcare and life sciences. I'm Antoinette Thomas, U.S. Health and Life Sciences Chief Experience Officer at Microsoft. Today, I'm very excited to be here with someone I've known now for a few years, a peer, a colleague, a thought leader in our industry, Dr. Bonnie Clipper. Bonnie is a nurse futurist, a top healthcare influencer, a thought leader in the nursing industry. Today, we're going to explore the future of nursing and the impact of innovations in technology. So let's go ahead and get started. Welcome, Bonnie.
Thank you. I'm excited to be here.
So we have a few questions I want to go through. I think it's going to be a really rich discussion, but I wanted to start us off by talking about the intersection of nursing and technology. So I really would like for you to share your perspective on how you see nursing changing with the application of technologies over the years and certainly into the future. I would love your perspective on how you feel about whether or not these have helped, hindered, and what is it that we in the industry can do to really deliver on the promises of technology?
Great question. So I'm going to try to peel these back maybe one at a time. Oftentimes when I am speaking around the country, we talk about technology and nursing practice. It is not uncommon to get a question or a comment about nursing in general. And the assumption is out there that we need to either be high touch or high tech. And the question comes up, and generally it's kind of a little bit of these casual, wait a minute kind of moments. Wait a minute, we're nurses. Nurses are high touch. Yes, and we are going to have to be high tech. It is no longer an either or, it's an and.
Mm-hmm.
So in order for us to do the work that we do, we have to learn not only about technology, but how to embrace technology, how to be developing and designing technology in our appropriate roles, and then how to integrate it into nursing practice. What if we approached it from what's the problem we're trying to solve? I have this issue. How can I begin to identify technology that's going to help me? I feel like that would help leaders describe the problem, define the problem, and then begin to isolate and focus on what could potentially be a solution instead of getting distracted by the shiny objects.
I love that. Other industries and healthcare and innovation. So we know healthcare is complex. We know it presents unique challenges, including, if you're digitally transforming, you have to consider the fact that it's life and death and there's serious situations behind the screen. But I really would like you to expand a little bit on some of the issues that are facing healthcare and nurses and transformation and how we might address that and how technology, people, and process can really help the evolution of healthcare operations.
Every single workflow is ripe for disruption and to be put together differently in a transformed way. I think technology is going to be our friend. It is not infallible. It is not perfect. It is up to us to try to identify where the gaps and the weaknesses and the vulnerabilities are to make sure that we mitigate for that and train healthcare professionals, nurses, physicians, how to work through some of those concerns. However, there really isn't a way around this. So as we all are familiar with the data and the trends where we're going in the nursing shortage, we actually know that literally in about 24 months, we are short between 200,000 and 450,000 nurses. That means there is simply no way, it is not humanly possible to continue to provide care the way we know it today. So without adopting technology to replace the low value added activities, or utilize it to help supplement the way we make decisions, the way we prioritize, the way we create care plans, the way we think, we're going to be in serious trouble. So I think we have to find ways to embrace tech.
But I guess it begs the question, how are we going to really begin to fortify the type of education around things like analytics, artificial intelligence, the use of virtual health or telemedicine? So, I mean, those are great insights, and that's just a couple of thoughts that I have as we really try to fill the nursing profession pipeline.
Yeah, I think you're spot on. And much of that particular part of the challenge around the production of new nurses, we also have to call on our schools of nursing to transform the way that they educate, right?
Yes.
So it just cannot continue the same way. We
Mhm.
have to figure out how to customize our approaches, and technology is going to help us do that. Are we there today? I think we have pieces. It's not comprehensive. It's not built together in a complex system that can actually help us as we move forward. I think we're going to have to figure out how to adapt those pieces and then how to amplify that work so it becomes much more commonplace, much more accessible, and begin to teach not only students how to use different technology, also faculty how to use the technology that's out there to amplify their work and make their lives easier. They're going to have to learn to scale, and that doesn't mean that we're going to get more human beings as faculty, right? How do you scale in a non-human environment? That's where we have to go.
Mhm. Fascinating. So, Bonnie, in an environment where there are healthcare, there's hundreds of challenges in front of us right now. Um, from your perspective, what do the right solutions look like?
We have to look at how we can alleviate this staffing and workload issue with technology. So I'm seeing the bright spot, in my opinion, that's out there is virtual care nursing. This is starting to really take off. And what CEOs like to think about is, ooh, I can lick my chops now because if I get this virtual care model, I need fewer human beings. Wrong answer.
Wrong
This
answer.
virtual model is going to allow you to provide safer care. You are going to be able to pull nurses back out of retirement that want to be the ones to provide this virtual set of eyes and ears and oversight. We're going to be able to provide a much safer orientation to nurse residents and new nurses. We're going to be able to get some help with the documentation burden. We're going to get help with admission documentation, discharge documentation, med reconciliation. The list goes on. So that's a bright spot for me.
So I think we're almost to the tail end. And this question is really around advice that you would have for healthcare and nursing professionals in an industry that is constantly in flux, changing, adopting new devices and solutions. This kind of harkens back to a comment I made about, in healthcare IT, one of the things that I think about when I go in and talk to people is we've made a lot of promises over the years. And there was no malintent in those promises, but we haven't delivered. And we've actually created a situation where the technology has become part of the workforce crisis burnout situation that we're in right now. So what is your advice, thoughts, perspective around these friction points, knowing that we need to move into the future, continuing to use technology, continuing to have to document so we can generate data that then feeds AI models? Like, what do you think about that?
Yeah, so the first thing that often comes to mind when you talk to healthcare professionals about technology is the EHR. We're going to have to use a whole lot of human-centered design to actually bring in the people, the end users, the patients, to design the systems and the processes that work. Because I think if clinicians are seeing how it can benefit them and work and improve patient experience and improve clinician experience, all at the same time, they're going to be very willing to do it. So I think it's out there.
I think, we need to let things simmer down. We need to deliver on our promises. And we need to get nurses back to, providing care at the highest level of their education and licenses, which is really, they're knowledge workers. That's really what they came to the table, to the institution, to the organization to do. So Bonnie, I want to give you a personal thank you for spending your time with us today and sharing your perspective. I know you're very busy, so it means a lot. And this was a very insightful discussion. So I'm excited to continue the conversation with you. And for our viewers, if you're interested in hearing more perspectives on top trends in healthcare, watch the rest of our series. So stay tuned for our next part of the series of top trends in healthcare, and we hope you watch. Thank you.